I'm Chanel Harvey, recently promoted to Hub Director at the Community Action Pathways Hub in Stark County. So is that all you wanted? I don't know what all you wanted.
That's great. Yeah, I feel like
Okay.
Stark County, you guys always show up. Were you on our one that we did like in May? Do you remember?
No.
No, okay.
No.
I feel like there were maybe some other folks from Stark County, but anyway,
Yeah, I
nice to
think
meet
there
you.
were quite a few from
Thank
Stark.
you.
Yeah, great. Monique?
I'm Monique Walker. I'm the Director of Energy Assistance Programs with Miami Valley Community Action Partnership, which is in Dayton, Ohio. So we serve several counties: Montgomery, Preble, Dark. And I'm recently with the just joined the agency about 4 months ago. So yes, this has been a really good conference.
Awesome. Yeah, Sorrel.
I'll go ahead. Hi, I'm Sorrel Howard. I am the Community Services Manager here at MyCap in Mahoning County. My team primarily is the community health workers. I keep hearing people say, I keep hearing Chanel say Pathways Hub. So we work with the Pathways Hub, our community health workers, with pregnant women in addiction, and we have a chronic disease part. We also are over the intake department for all our special grants that pay the rent, utilities, and mortgage payments from the COVID funding.
So you probably know Michelle Edison, right?
That is my bestest friend.
Yes.
She's a sweetheart.
Great, thanks for joining. David?
Good afternoon, everyone. I'm David Droll. I'm the Finance Director at MyCap. I make sure that Sorrel doesn't overspend her budget there. And I'm coming up on 1 year of service.
Awesome. Joan?
Hi, sorry I missed the first. I had to step out of the office. I was just typing that in the chat to assist a customer and maybe having to go back into that same reps room with the customer. I'm Joan Turkovac. I'm HEAP Director. I've been with MyCap for 28 years. I'm here to assist the customers and learn whatever I can with these new programs that are all being instituted in a timely fashion, aren't they?
Great. Did we miss anyone, Sharon? That's everybody.
Yeah, I think you got everybody.
Okay.
Yep, looks good.
Okay. Well, I'm Becky Watts. I'm with G2G Consulting. We are a government relations consulting firm. Liz Powell is also on the line. She's going to give you kind of the overview of everything we do. And Greg Kapkar is also on our team. And we are here today to talk about advocacy with impact. So all the work you guys are doing kind of in the field, there's so much that is impacted by state and federal policy by lawmakers in Congress and in the executive branch. The programs you're administering in many cases are impacted by decisions being made by those bodies. And so those lawmakers and policymakers don't know what changes are needed unless they're hearing from organizations like yours and your constituencies that you're serving, and folks that want to engage in advocacy or boards, et cetera. So I think the purpose of our breakout session is to kind of talk about the best, some best practices in terms of how to approach advocacy in an effective and impactful way. And that's kind of what we do on behalf of a lot of different organizations throughout the state of Ohio, as well as other states as well. So I will kick it over to Liz to introduce us and start off our slide deck.
Hey, Becky, just real quick, this is Greg. Are the slides still up on your screen?
Yes.
Okay, all right, because okay, good. Just wanted to make sure there were no technical difficulties. Go ahead.
Great, thank you. Nice to see you all. Happy Thursday, almost Friday. So I'm Liz Powell, I'm the head of G2G Consulting, and I think my role is just to really kick things off with some background. So could we go to the next slide, please? So we'll just cover how government works and then get into federal update and Ohio update. And then we wanted to share insights on how to access earmarks and work the capital budget, which is just around the corner, and talk about your advocacy plan. We want to answer questions. Obviously, it's a small group, so for Cash, you can just ask your questions while we're talking. We're easy. So with that, we'll go to the next slide. So I started G2G in 2007. I worked on Capitol Hill for several years as a legislative director for a couple different members, and always did a lot in health policy and education, social welfare. And so really passionate about those issues. And I'm also an attorney and I have a master's in public health. And so with that background, I actually came to Ohio as part of the Kerry presidential campaign, which is like a million years ago, but it was 2004. And I did a little bit of consulting, did a couple things, and then started G2G because I met a lot of wonderful people and really making a difference, but they didn't know how to access funding or really maximize ways to grow their organization, increase their reach by working more effectively with government. So that's where I got the idea of G2G. And so G2G is government to growth. And so we really want to help organizations and companies who work with a lot of startups, all trying to make a difference in the world, just do it maybe faster, better, with amplification by teaming up with government. And so our biggest metric is in that upper right-hand corner where we've raised $322 million, actually more than that now, for our clients for some really great causes since 2007 when I started. So we've done lots of advocacy campaigns, federal, state, local level earmarks, policy shaping, relationship development, all kinds of things. And so I would say at the core, we are all about making a difference. And so that's just a little bit about me and sort of the story of G2G. And we've known Yvonne for several years, maybe even dating back to when I started or soon after. And so we're big fans of Yvonne in particular and all the great work that she's doing. So wanted to mention that as well, but that's us. Next slide, please. So here's just a quick overview of government. Am I covering this slide?
Yes, very good.
So the three branches of government, we all learned this many years ago, but the executive, they do executive orders, they shape regulations, and they really do get into the weeds when bills are passed or enacted into law. It's the regulatory, or what we call administrative law among lawyers, that really determines a lot of what you can and can't do. So it's actually pretty important. But the big stuff that you hear about from Biden, a lot of those are executive orders, events, that type of thing. But it's at that rulemaking regulatory level that's really critical. And we often get in the weeds on some of that, especially with a lot of the health policies and COVID response and that type of thing. Legislative, that's Congress. So you've got the House and the Senate. Some really important committees in both chambers are the Appropriations Committee. They determine the funding levels. The Budget Committee, it determines sort of the outline or framework for what they're going to spend funding on. Reconciliation is what you're hearing a lot about now. That's a unique budget process that allows the Senate to pass with any sort of financial budgetary legislation with a simple majority. And so that's why you keep hearing that over and over again, and how this new administration, working with this very slim margin in Congress, how they're trying to ram through some measures right now. So anyway, when in the legislative process, it has to go through committee before it comes to the floor, and then it has to be agreed upon between both chambers, and they usually do that what's called a conference committee, and then it is sent to the White House or to the president to sign to become law. And then judiciary. So that's obviously once it's become law, the rulemaking has happened, all that's already happened, and now it's getting implemented. And people file lawsuits to challenge whether it's constitutional and then that's where the court has a lot of power. So we saw that with the ACA, Affordable Care Act, or Obamacare. We saw the huge impact of the Supreme Court in that case. But knowing sort of how these three levels of government interact with each other can be really helpful as you're trying to do advocacy. There's quite a bit of advocacy and change making that can happen without ever passing a law. So it's really important to understand how all these work together and where to spend your time, because we know it's limited. There's every 2 years as far as how they do the budget. So 1 year it's the capital budget, and then it's not for another 2 years that they'll do capital budget. And then operating budget, again, alternates every 2 years. So it's really distinctive. In Ohio, actually, I've worked in a few different states now at state level. It's really distinctive, Ohio, to do it every 2 years. It's not the only one, but it's one of the distinctive states to do that. And the other thing to note is earmarks are definitely back at the federal level. They had an 11-year moratorium. Many of us were very sad about that because we found them very, very useful. And they are now back. And so we're seeing them in both the House and the Senate reports that accompany their bills that are coming out now. What will actually happen is still yet to be determined. And so we can't quite say that they're absolutely back because they have not finished. We are expecting an omnibus bill at the end of the year where they'll fold together all 12 appropriation bills and their reports that go with them. And that's when we'll know for sure that the earmarks came through. So it's still a little bit tenuous about that because the way the House and the Senate have done things are different. So of course it's challenging and up to the wire. So I expect like a Christmas Eve type of bill to be passed, and hopefully that will include earmarks. If that happens, then definitely earmarks will be back again next year. And so you want to be really well positioned to make a request for an earmark for your organization starting in Q1 of next year. So that's why it's really important. As for the state level, they never went away. So we had them before, we have them now, we keep having them. Those are great. So we want to make sure you know all the tips and tricks to pursue earmarks on that state level, because that's a really, really good opportunity for you all. So I think I've said enough on that slide, probably too much. Next slide, please. And this is the puzzle, all the pieces that come together. And I think for this one, I am passing it off to my colleague.
Actually, I think this is you, and you're going to do the federal update in the next couple slides, Liz.
Oh, I'm sorry. Okay. So sorry about that, people. We'll just go with the flow here. So legislative process, I talked about that. Polling and media. So a lot of what Congress does is in reaction to polling or in reaction to what's going on. So obviously COVID, that's a big one, the insurrection in January. So a lot of what they do is response to media coverage and polling. So what does that mean for us as nonprofits? Well, if we're working on a really important issue in poverty, for example, if you can get an op-ed, or you could get a member of Congress to pen an op-ed, that then raises the profile of your issue and really does get their attention. So again, this could be at federal level, state level, local level. So just keep in mind media engagement as you're trying to do your advocacy work. Community support is really important. So those that you serve, get them to be part of a letter writing campaign, get them to come meet with the state legislator when they come through for a tour, or bring them down to Columbus. Engaging the people that you're working with in your advocacy effort is so powerful. It's empowering to that person. It is eye-opening to the public official. It's just a win-win all around. So really, really want to emphasize that one. It also makes it truly authentic, why you're asking for funding or why you're asking for a policy change. Agencies, as I mentioned earlier, there's an awful lot of rulemaking. There's a lot of discretionary power. For example, the Secretary of Health and Human Services, he has 3% of his budget. Hopefully we'll have a her one day again, but his or her budget to do whatever he wants with. 3% of HHA's budget, that's actually a lot of money. So there is discretionary power within agencies. We have a former client we worked with that was doing a great workforce issue for women in non-traditional careers. We just pounded and were able to get a $150,000 contract out of the state. It was not written anywhere. It wasn't competed. All that was working directly with the agency. So there's things that you can do by working directly with agencies, whether it's funding or a policy change or just awareness of an issue. Elections. Hello, we've got really important election coming up in Cleveland for a new mayor. First new mayor in 16 years. We've got next year, we've got state legislators up. We've got congressionals up. So there's always interesting elections shaping what gets done in the legislative process as well. And we certainly want you to be very savvy in not having the organization support issue though, like levies and bond issues. You can definitely be out on that, but you want to make sure that you are talking to all candidates and not picking sides when it comes to elections. Leadership on committees is super, super important. They really control what's coming to the floor or what moves to the committee. Again, this is both federal, state levels, even at the county level, county council activity, city council activity. So make sure you're aware of who the leaders are and you're finding ways to connect with them, even if they don't represent a city. Maybe that you can connect, like broadband, people think it's rural, but it's actually a city issue as well. So that could be an issue that you connect on and can show that there are things in common. So that's really important to be targeting the leadership. You also want to, work with lobbyists if you can. We certainly think lobbyists can be good people. They get a bad rap, but lobbyists really are advocates. And so we can be part of that effort, or even working with broader coalitions, sometimes a coalition or other organizations, even for-profit companies that really care about the causes that you're addressing. Sometimes they have lobbyists that can be really helpful as well. So just thinking sort of broader outside your box can be super helpful. And then, really, and then events, engaging folks in events, and then government, that's that centerpiece of all of it. So we want to make sure that you're putting all the pieces of the puzzle together to really connect with government in an effective way. I think that is it for that slide. Next slide, please. Federal updates. So I guess we're talking about what's going on now. So you have the American Rescue Plan that was already enacted. We have the infrastructure proposal that's still pending. And then we have the larger sort of social infrastructure bill. And actually Biden was meeting with the Democrats in Congress this morning. And in fact, we actually held a congressional briefing I just came off of on vaccines. And our first speaker is a member of Congress who was late because he was meeting with the president. I'm like, that's the best excuse to be late. I'd love to try that one. So anyway, but in this meeting, they weren't allowed any cell phones. It was like straight up confidential meeting, trying to finally get all the Democrats united. So it seems like we're inches away. We are going to have a deal. So that's great. It will be less than what they initially proposed, but that is coming out pretty soon. And what's really interesting is it's actually shaping elections. So I actually am dialed in today from Virginia. I live in Northern Virginia, just outside of the Capitol area. So that's where I've got the Capitol building behind me. But so we have an election. They do elections on off years in Virginia, and they are finding that if the president can announce this deal before Election Day, which is next Tuesday for the governor, it could literally turn this race. It was supposed to be the Democrat that was going to get it, and now the Republican has come up so tight, it's now literally 49-49. And they're saying that this infrastructure deal is what can make or break it. So it's really interesting how elections and Congress and state legislative activity, all of it is very much intertwined. And the other thing that's coming up is the appropriation bills that I mentioned earlier. So we expect, because they've moved so slowly, the House did get their different bills done, but the Senate did not. So we expect some omnibus deal to happen, as I said, sometime late in December. Right now, we've got a continuing resolution that ends December 3rd. So I expect another one after that. And then, like I said, right before Christmas, we'll probably have some massive deal with all these things sort of wrapped up. That is the quick legislative update, although it was probably not quick enough. And with that, I would love to move on to the next slide. Ohio. Now I believe this is on to Becky. Thanks.
Yes, thanks, Liz. So as Liz mentioned, the Ohio operating budget is a vehicle that must get passed every 2 years in Ohio. This past cycle, this past spring, the legislature just passed the fiscal operating budget for the next 2 years. And this is there's always a flurry of activity down at the State House in Ohio around this budget because it's a must-pass piece of legislation. Everybody's got, a piece in, skin in the game, if you will, because they've got something in there that they care about or their constituents care about. The Ohio legislature, as you may or may not know, is made up of the Ohio House, which is 99 members, and the Senate, the Ohio Senate is 33 members, super majority Republican in both bodies. But nonetheless, they were, Democrat members are also have a lot going on in this bill, and it has to be passed by June 30th of every year because the new fiscal year starts on July 1. So when we talk about advocacy and opportunities to influence the process, this is one piece of legislation that everyone views as a vehicle for policy writers in addition to funding priorities. And some of the things that we just wanted to highlight that occurred in this past budget bill that might be of interest to you all included the child care changes, which raised the income eligibility requirements from 130% to 142% of the federal poverty level, which will enable an additional 6,000 children across the state to be able to be eligible for affordable childcare. So that was a pretty big change. In the workforce development category, this tech cred program that I mentioned here and the industry recognized credentials for high school students were all part of the DeWine Husted administration's interest in improving upon the technical skills of Ohioans to kind of meet the changing workforce demands, the gaps in the workforce that we hear a lot about, an effort to help upskill current and future potential employees, as well as giving high schoolers opportunities to gain these industry recognized credentials, giving more high schoolers pathways forward that don't necessarily require college degrees and work directly in industry and have sort of a background. So that was something that the DeWine Husted started on in administration started putting forward in their initial budget, and this is their second budget that just kind of passed this last July. So that was kind of a big deal in the workforce development space. The broadband expansion efforts have been in play for close to 5 years in the legislature. The pandemic, of course, highlighted the disparities existing in Ohio in terms of not only access to broadband and ability to get on the internet to do all the remote work and learning and telehealth that had to be done during the pandemic, but also not just the lack of access, but the lack of affordability. Liz mentioned it being very much an urban area issue, in addition to people always thought of where in Ohio can't you get internet? Oh, it's probably like southeastern Ohio, Appalachia. That's not the case. There are definitely neighborhoods that do not have access or have very poor access in many of our urban areas. So the legislature to pass this this bill, a bill to create a whole broadband expansion grant program that is underway now, and they're planning to really look at additional opportunities to fund digital inclusion, digital equity, digital navigator type programs to help people, once they get access to the internet, to be able to learn how to use it and to get computers and cell phones, and going beyond just here's a hotspot, let's address this temporarily, but looking at this as a long-term issue, because they're really looking to the internet is clearly here to stay, and is going to be improving in speed, and people need to be able to access it and keep up, and as well as businesses. Again, telehealth being a key part of that in education and remote learning, and even not even in remote learning, but in learning, doing your homework for many of our children. You have to have internet access. Area, of course, which we know is of interest to a lot of the work you're doing in the housing space. Lead Safe Housing Fund was included in the last budget. $25 million in competitive grants to Ohio communities to abate lead hazards in their housing. Lead in homes in so many of our older neighborhoods in the country, or in the state, is a huge issue. Again, another priority for the legislature and the DeWine administration. Housing for pregnant mothers, looking at infant mortality rates, and all of the different factors. The legislature included this funding for housing initiatives for pregnant mothers through Department of Development, and the Ohio Department of Health, and the Governor's Office of Children's Initiatives, which is a new office that DeWine established when he came into office. Stable housing for adults with mental illness, also another provision. I noticed somebody had a chat this time, and it's Lead Poisoning Prevention Week. That's right. Good. Next slide, please. So now, as Liz mentioned, the Ohio budgets are every 2 years. So we just had the state operating budget that I was just reviewing passed June 30th. This coming year, the legislature will consider the Ohio capital budget. And while this is a much different budget in that it's the bricks and mortar type of budget for state agencies, state facilities around Ohio, higher education institutions, in addition to state agencies in their buildings that they have throughout the state. There are also opportunities for nonprofits to secure bricks and mortar funding here. This is just a little bit of timeline about how it works. We can go to the next slide. I'll talk about it a little bit more there. In terms of the earmarks that one can pursue, if this is of interest, I don't know how much your individual entities have need for bricks and mortar type of requests, but nonprofits are eligible if they have what's called a nexus to the state. So the funding has to come through a state agency. So that's a really key point, because there has to be a kind of legitimate relationship between a nonprofit and the state agency it's going through, the funding is going through. What qualifies bricks and mortar projects? It has to be a bondable project. And again, this nexus to the state agency. Earmarks are generally in the ranges of, from smaller amounts, from $10,000 to up to $5 million for individual projects. And in talking to your legislators, if this is something you wanted to pursue, timing wise, now is the time to talk to your state legislators and find out what's going on with this process, in their office. How are they approaching it? are they working with the regional economic development organizations, such as like the Dayton Development Coalition, the Greater Cleveland Partnership, the Youngstown area, Youngstown Warren Regional Chamber of Commerce, Cincinnati Business Chamber, Columbus Chamber, Columbus Partnership. They have a big part in this process. Those entities do. So talking to those entities as well is important. Having support letters from your organizations that you partner with, also key. This bill is generally unlike the state operating budget, which has an opportunity for you as an entity to testify publicly before the committee that's hearing the budget. This one is like a pre-negotiated type of a bill, so all of the prioritization of projects happens before the bill is actually introduced in usually like late February, and is passed very quickly out of the legislature. So it's sort of, now is the time to be talking about it if this is something you wanted to pursue. And just on the timing piece again, that the December and January are when the actual deadlines are usually members of the state legislature. So going back, sorry, I skipped around a little bit, but going back to the state operating budget piece, if you are, thinking about your advocacy plan in terms of the state operating budget, really you want to kind of get your ducks in a row by next fall, summer and fall, and start making your case with your state legislators. That's not to say that you shouldn't be starting to do that now. Now you can, oftentimes in our advocacy work, we like to go to a policymaker, member of Congress, or a state legislator as an introductory type of meeting with an organization before we have a direct ask. It helps establish that rapport, establish that relationship. If you can invite the legislator out to see your agency, your work in action, if there's something like they can see and feel and touch type of, have a tour that way, that is generally very impactful. Hearing from people that you serve directly about how they've been helped by your work, also very impactful. So now is the time to start doing that, even if you don't have a direct ask or haven't figured out what it is you would want to change from a policy perspective. But once that's been done, then next summer, fall, you should start figuring out, okay, what about these state policies are really impacting my constituency in a way that's not effective and more harmful, or what can we change, and figuring out, okay, what can we work directly with our state legislator to change, potentially in the budget. Again, that's must-pass legislation, or in standalone legislation. It might not end up being a budget issue at all. But in terms of the state operating budget, next summer, fall is sort of the time to do your work, and especially if you're trying to secure an earmark. Next slide, please. Okay, I think I'm, if anyone has questions, I know I just sort of covered a lot quickly in the interest of time, so I'm happy to, take questions at any point. Otherwise, I will turn it over to Greg to just kind of talk about putting it together an action plan.
Thanks, Becky. Sharon, can I get a time check? How much time do we have?
You've got about a half an hour.
Oh, okay. I
Yep.
thought we went to
We go to 2:45.
2:45. Okay.
Oh, we thought
A little over
2:20.
half an
Okay.
So you can talk
Yeah,
slower.
Okay. No,
That's what I was talking about. I thought it was
I'm
2:20. I'm like, oh no.
I'm waiting for the questions because this group was full of questions with the morning session. So I'm just, and everybody's got their camera off. So I'm wondering if they're all still there.
That's
Mr.
okay.
Rell,
We'll-
surely
I'm
you have a
here.
question.
I do. Maybe not just a question. I know, I just politics in itself, right? So for me, it's sometimes a little bit frightening when I think about it, but I know I have to engage, and I come from a union background, so we were very engaged when I was in my union and policy and different things. It changed differently, you know, coming over here and what we're allowed to do. Maybe I haven't really grasped the full scope of everything we're allowed to do, but I always ask before I do something. They say, yeah, you can do that. No, you can't do that, you know? So that's how I kind of gauge what I could do here. But I guess, you know, some of the things that they're talking about when we come to our community and, you know, the broadband issues, the telephone issues and internet services, definitely have had a hard time trying to engage the rural community and our area. I just always feel like they haven't come up with the best solutions yet, you know, and even what they have out there, I don't think will ever work. That's a lot of the reason why I left Job and Family Services. I generally try not to be a negative person anytime. I'm always trying to look at the brighter picture, the glass, you know, half full, but just working in this area, they're trying to get me on the phone. I'm gonna ignore them for a minute. It's in-house too. Working in this area, we generally ask our most indigent clients to figure out how to use technology with the very little resources, you know, and that's kind of why I left Job and Family Services. Phone interview necessity, and then their benefits were contingent on if you answered the phone, right? But a person answering the phone could be anywhere. Right? So we're supposed to determine fraud, but they could be anywhere. They could literally be answering the phone in a whole nother country. And I say that because that is literally how it worked. Everything turned into a phone interview. And if you don't answer the phone at that particular time, then you missed your appointment. Well, then how do I got to reschedule? Well, it's all electronic to reschedule. And so people that don't know how to maneuver, don't have the means to maneuver, may have only a few minutes, and you're in a, you know, if you call places now automated, you could be on the phone forever. So then we tick off minutes for a client that needs assistance, and they get on the phone and hang up. And we penalize the most indigent. And then as far as this broadband issue, yes, we definitely need greater access. But I found with doing the grants that we pay for with all of this COVID money, we're paying all of this money. The biggest thing was, can we pay internet? Absolutely, we can. But we can't pay if it's bundled. Why? Because the powers that be to control all the internet broadband won't accept our payments in a lump sum. And if people are bundled, we can't keep their internet on if we only pay the internet portion. They cut you off if you don't pay the whole bill. So if they couldn't afford to pay the internet part, and they couldn't afford, and it's bundled, and we're paying paying the telephone service and the cable part connected to it, they're still cutting their services off. So it's broken. Even though we allotted all this money to pay for this internet service, it only works if they only have internet, because they literally want direct payments, and they want the whole thing. Paying a portion of the bill doesn't keep everything on. So that's just my spiel. I think it's, you know, when we think of rules and we think of laws, we don't always we don't ask the people what they want. We think we can figure out what they need. But you gotta ask them what they want and how will it work better for them, because they're actually having problems. So we get a bunch of thinking minds in one room and say, this what they need, this will help them, this will fix it. And with all this money to pay all those bills, we have fixed nothing when it comes to that.
Sorrel, you're absolutely right. Because even what you just said is they need this, they need that. They're not at the table to say what I need. I need this. Like, we keep putting all of these roadblocks in the way. Like, we say we want to help, but to me, I say they're just giving us lip service. This lip service is not actual action, because you put roadblocks that prevent people from being able to take advantage. So then it becomes this, well, they didn't take advantage of it. Well, you didn't make it accessible for them. So one question that I did have was, you mentioned that there was nonprofit brick and mortar project funding. How would and because I want to make sure I understand it, because when we start talking politics and stuff, I really hate all of that. How would we go about accessing that? Because I know like we need to do some brick and mortar upgrades and things here, but all of our hands are tied with the funding that we do receive on how we can actually implement that. So I guess, can you provide some more insight on the qualifications for that, who we would contact to start that process?
Yes, I will talk about that, and then I will try to address your question, Sharon, that I see you just put in the chat box.
Oh, I'm sorry.
So you're Chanel in Stark County, is that right?
Yes.
So I would recommend, I mean, so a couple of your state legislators are Scott Olslager is one. Representative Olslager, he happens to be a very influential member of the state legislature. He is the House Finance Chairman, so he's at the table, helping to make decisions about what projects get funding. Another one from your areas, State Senator Kirk Schuring, who is part of leadership in the state Senate. What I would say is, they both have email addresses, to their offices that are staffed there to inquire, saying I'm, a community action agency looking at the capital budget. Could you share with me? Do you have a form? And get into and could you walk me through this process and whether or not I would be eligible?
Okay.
And I would start with them.
Thank you so much.
Yeah. Oh, Greg, you're starting to show your your other screen stuff. I would also say, in terms of Sharon, your question about the context of the system, how would we go about solving that problem to get payments for bundled services? Yeah, that's an interesting. I think maybe what we're talking about is the emergency broadband benefit that came through individual providers from the federal government, but through the providers. And I think what you guys are saying about, everybody thinks they're solving problems for people who aren't actually at the table to describe their problems is exactly where you all come in as excellent advocates. I mean, you're hearing every day as to what the problems are in actuality in the implementation of these programs that government officials think they're solving. But if advocates like yourselves don't come and voice what those problems are and how the implementation didn't exactly go as planned, or that's your opportunity to engage and to say, and that's kind of what we'd recommend, like going into a meeting with a legislator would be great to say, okay, these are like the 3 issues I want to talk about, broadband and the actual, what it looks like when my, people we're working with are trying to have these appointments and, unable to get the, the broadband access they need because of the bundling problem. So it's best to go into a meeting like that with some very specific, here are the top 3 kind of points I want to discuss, and here's some suggested solutions.
Yeah, that's awesome, Becky. And that's probably a good segue into some of the next slides that we're going to cover about putting what you've learned into action. And I think let's go ahead and move on to that. And then I think we'll cover some of the questions that have been addressed. So my name is Greg Kepkar, and I'm in our Midwest office. And my background is really in the nonprofit sector. I started with what is now Ohio Guidestone, which used to be Berea Children's Home and Family Services. And I was there for 12 years and actually helped stand up a government relations, government policy program there. And we were successful at that time of going after some operating money. It wasn't a lot of money, but for our, at that time, it was $20,000 we got for one of our childcare centers. And that helped quite a bit. I mean, so that was state operating money. We were also successful in going after a state capital project earmark. There were some improvements on the main campus, and we got $250,000 for a new treatment center at the campus. And then we were also successful in getting about $180,000 for a school age based program through one of our other child care centers. That was actually a federal grant, a federal program that we had lobbied Becky and her boss when Senator Mike DeWine was, Governor DeWine was then a senator. We're going to talk a little bit about some advocacy tips. And one of my mentors used to say about advocacy, and maybe she got it from another source, but she would remind me all the time that you're not guaranteed to get anything by advocating. But if you don't advocate, you're guaranteed to get nothing. And so if you were to ask me of our presentation, which of the slides are key, or just to point you to one slide, in my opinion, it would be this one. This gives you the framework for how to like have advocacy with impact. Now, there's a lot of stuff nestled into this one slide, but it's a great slide as a framework. So, as we look at piecing all of this together from what Liz has talked about and Becky has talked about, one of my favorite parts of advocacy is really the strategizing and laying out the plan. Issue is pretty awesome too, but along those lines, we actually defeated, not here at G2G, but when I was I also served for about 7 years at the Public Children's Services Association of Ohio, which represents all of the child welfare, public children's service agencies and the foster children and youth in Ohio. We actually defeated a draconian policy that would have implemented sex offender type registration for kids in foster care. So these were not kids that were sex offending histories or anything like that. It was just for the mere fact that they were labeled a foster child. There was a legislator that wanted community notification, or the communities notified that these kids moved into their neighborhoods, which was just ridiculous. We defeated that not once, but twice. And he was very close to getting it through as the chairman of the committee. And we were successful in getting him to take it out on the floor of the Senate. I mean, the bill was just about to pass and we were able to get him to take it out. So it was like an 11th hour sweet victory. And it's just kind of an excellent example of kind of never giving up. We could actually spend an entire workshop on that issue alone as a case study, but and I prefer to be on the side of like proactive policy, but sometimes you've got to play defense on some of these issues. So it's important to have an understanding of the process and the timing that Liz and Becky have talked about, and then a sense of the role of politics. I know somebody had mentioned, they don't like politics, and I get it. But it does influence and shape your efforts, and kind of figuring out who the major players are and who the decision makers are and how all of that fits together is really kind of exciting. So every place that I've worked has been doing policy on a bipartisan way. So we're engaging both sides of the aisle, and it can kind of be overwhelming as to where to start. And the first step is this assessment step of the ladder. It doesn't have to be a long drawn out assessment, but it just has to be, sometimes people come and say, I just want money for a building, or I want certain policy, or this policy is bad. What really is helpful at this stage is and we help our clients kind of peel away the onion on those issues. So how does the money that you want for your building, or the funds that you want for your community outreach program, how does it impact the community? How does it impact decision makers, constituents? How does it impact the region? What's the impact on the state? Can it be replicated in other parts of the state? And then as we move up the staircase here, the targeting piece, this is one of the pieces I love the most. I really think of this as kind of stakeholder mapping. And it's just a session of sitting down, like, who do we know that knows someone who knows someone else? So an example of this, when I was at the children's home and we were trying to get connected with our senator, right? So we start kind of where our organization is housed, and we want to make sure that our local, state, and federal officials know what we're working on. we were trying to get our state senator out to come and do a tour of the facility, and we just was not getting any response from his office or from him personally. And it just so happened to be an election year, and a member of our team lived in his district, and he knocked on their door and was trying to get her, he's knocking on his door, he's stumping, and she's like, oh yeah, I've heard of you, and we've been trying to get you out to Berea Children's Home to visit the tour. And within a couple of weeks of that, wouldn't you know, he came out and toured our place, and he became the biggest champion for the efforts that we were doing. So it's just that kind of like coming at it from different angles. How do you reach these folks? But and I mean, there's a whole thing of like your legislators, the regional legislators, then who's on committees, and how do you just kind of reach the decision makers? The next thing to get in order is the messaging. And here at G2G, we often talk about getting our message down into a one-pager. Like, talk about what the problem is, what's the solution, and then what's the result. And this is a really critical step for framing your issue, knowing what you're asking for, knowing what the needs are, and also what the problem is. And while we identify the solution and why should these people care? What are the results? And one of the things that where we don't want to fall short of is just identifying a problem. Legislators, decision makers hear all the time about, what the problems are. If we can come to them with a recommended solution, that gets us even farther down the road. And oftentimes, as advocates, we play the role of, not only are we a constituent, so they need our vote, but we also play the good role of being kind of an informant, keeping them up to date on the issues, briefing them. And with the way term limits are in this state, there's constant turnover, could be every 2 years. So it's just kind of this continuous way to build relationships and find these folks to be on your side. And then if we move up the ladder to engagement with decision makers and community, there's a number of things here, but in my mind, the ultimate goal is to find a champion, and ideally find a champion on both sides of the aisle that believes in your issue, that wants to take your issue, and then you start to build a coalition of champions beyond that. And you can do this a number of ways. There's obviously, you can do one-on-one meetings are effective, but those can be time consuming. Ideally, if you're working on an issue, you give yourself enough time that you've got enough runway space that you can do all one-on-one meetings with everybody. But if that doesn't work, we've had great success at doing legislative briefings where we will arrange with a delegation, say for Stark County or for Cuyahoga County, and we get as many legislators as we can into one room or on one Zoom, and we just brief them all on a particular issue. Pre-COVID, and now kind of as things are hopefully winding down, or we're seeing things doing more in-person events, doing State House days. So actually booking a day at the State House where you go and can put on a little program, they can come and see what you're talking about, and then you can also have one-on-one meetings while you're there. We've also done roundtables and tours. You can invite legislators out to award ceremonies, certainly want to get them on email lists. So there's a number of ways to engage decision makers and make sure that they know what issues you're working on. And then from the community perspective, being part of the coalitions are extremely valuable. You can use these coalitions to submit support letters on an issue. And one of the things we were notorious for at the Public Children's Service Association was getting all of these supporters' logos on one letter and sending that letter with all of these logos to the people that we're trying to reach, whether it was the governor's office or whether it was the director of Medicaid or the Department of Education director, whomever. Just showing that broad reach carries a lot of weight and value. So it shows how far that constituency reaches. There's also a way to do action alerts. And so if you've got a core base of constituents, having them go to council meetings or go to meetings in their districts or in their communities and raise the issue and testify on things. And there can be letter writing campaigns. So there's just a number of ways to engage the community. Liz talked about one of the puzzle pieces being media outreach and events. And, this is where, you've got to be careful when you're, within an organization and knowing kind of what the protocol is to being able to voice your opinion, whether you represent them or not. But, as a citizen, you can write op-eds or letters to the editor. The organization certainly should be doing op-eds if there's an issue, getting that to the papers. We've also done tours for the media. So reaching out to reporters and bringing them out to the community to actually highlight an issue helps raise it. And I mentioned early on about that policy that we were successful at PCSAO in pushing back on this legislator who wanted to make foster kids register in the community. The day that it was up for a vote, we talked to then Bill Cohen, who used to be with Ohio Public Radio, and he did a story on it that day. And I mean, there were all these pieces that came together that kind of helped push things over the edge. And then lastly, when it comes to keys to advocacy is follow-up. Timing is important. So Becky talked a lot about the timing for these budget bills. There's timing for legislative bills. So it's important to know that, or learn that as you're going along. We at PCSAO talk often about being politely persistent, that we may not get an answer all the time. And that's okay. We just can't take that personally. We've got to keep going. We'll keep coming back to them. We'll keep finding a different angle. My example at Brea Children's Home of the staffer, I mean, it was just the stars aligned. He happened to knock on her door. She was aware that we wanted to get him out there. And she happened to mention it, and boom, there he was. He's on our doorstep wanting to come. So, it's just being that persistent, not burning bridges. You never know when you're going to be on the same side of an issue as an opponent. And, politics does make for strange bedfellows. And we have lobbied on, when I was in the policy world as a legislative director down in Columbus, there were issues that we didn't agree with other organizations, but later on, there were things that we were on the same side of the issue, and we could form a coalition and do those types of things. So this next section in our presentation was really kind of designed to work together on a plan and just kind of pause here. I know we've done a big data dump of stuff, and wanted to get some feedback, or looks like there's some stuff in the chat that maybe someone can guide us through. But this is a time where we could take, we want to hear about your issues. We could take one and kind of talk it through. And so I'll just kind of pause there. And whoops. So we could take an issue that's important to you and just kind of, based on what we've learned so far or talked about so far, just kind of strategize together. Maybe the broadband issue is it. And we can kind of revisit that and come back to, okay, well, what's our first step? How do we want to attack this? Who do we target? What's the messaging? So I keep saying I'm going to pause, and I'm going to stay true to that right now and just kind of pause and let you guys react.
I know with the hub dealing with infant mortality, one thing I've advocated through the Ohio Task Force with listening sessions and things, and they actually have added some language to get more supplies and things to breastfeeding mothers. But another issue is payment for doulas and lactation consultants, things of that sort that are not tied to a hospital system. So I guess that would be something that I would like to advocate for.
That's great. Okay. And I'm glad you mentioned that, because the other opportunity is like, are there examples of successful advocacy that folks want to highlight and things? But so if we want to stick with the doula example, so can you talk a little bit more about the issue? Like so payment for that, give us a little bit more.
Yeah. So doulas are not necessarily like a medical provider. They don't have to be a registered nurse. They don't have to work underneath a doctor, but they do go through training there are multiple entities that they can go through to receive their certification to be a doula. And there's postpartum doulas, prenatal, and there's also even, I believe, like death doulas or something like that. I'm probably using the wrong term, but the Medicaid is not, or Medicare even, is not set up to allow direct payment to them because they're not medical providers. So how do we get around the red tape, even for a breastfeeding or lactation consultant? They're not necessarily tied to a health system or a doctor, but they have been certified to provide those services. So how do we get them payment so that those people that are, especially African Americans and minority populations that are dealing with infant mortality or postpartum death or whatever, how do we get them the services that they need? Because obviously the issue is within the medical system. So if you require the services that will help eliminate that to go through the medical system, that is the problem, you know, it sort of defeats, you know, our efforts.
So you've got 10 minutes to solve that problem, Greg.
Yeah.
No pressure.
No pressure, right. So, well, let's go back to the steps and I'd open it up to the group. You know, so you've done a great job of assessing the need. So, so the constituent population, so this is would you say this is a state issue, a local issue?
It's definitely a state issue.
Okay.
In Ohio, for every white baby that dies, almost 3 Black babies die. And I'm sure Sorrel probably can even speak to that from her county as well.
I want to say that, you know, sometimes everybody do the work, but nobody meet with all the work. We got all the numbers. That's one thing that we know for sure. They've already identified every target space in the state of Ohio with the infant mortality rate. That's something we do over and over and over and over again.
Yep.
I'm tired of going to meetings where we all know the numbers. What's the action, right? So they know where the babies die the most. They know who is affected, but they're not talking to each other, and that's broken. Everybody has their satellite things and think they can fix it in that space. So for me, I've always said Job and Family Services was the biggest missing piece to this, because it's generally the lower income families that are on Medicaid that have this issue, you know, because when she's saying it's not a Medicaid covered service, I mean, not a medical covered service, it's really not a Medicaid covered service. Most individuals that need, if you have regular insurance outside of Medicaid, there's some doula stuff attached to your insurance. Yep. There's some
other that's not necessarily true.
Not all the time, but it's other ways to get it. I'll put it that way. How about that? You have more, you don't have to get an approval for this and that and that. Well, what we know is, and having these attached services, the doula services, they got the information. What was successful? How did the rate change? Or how many people were helped by it? And how many babies lived and made it? One thing we know in 2020, they haven't quite came out with all the numbers yet, but we knew everybody had to stay at home. So the rates changed because nobody could go nowhere. Nothing was open. There was no way. We targeted putting food, access to healthy stuff in the community because COVID happened, you know? So the rates pretty much stayed the same, or they didn't get worse. Let's put it that way. But they know all of this information. And even our governor, he made a specific task force for infant mortality issue, you know, like that. He knows it. So they have the numbers, yet and still the Medicaid piece is the part that's missing, because we don't attach what worked to the services that we need. We need to pay for what worked.
So along those lines, you have touched on a number of key targets, and that would be if there's a coalition of entities like yourself or advocates, taking your numbers and mapping that out of where do these numbers match with state legislators, and then start to meet with those folks. So I think there's a multiple layers here of potential decision maker targets. The one would be taking your map and looking at, okay, what districts are we in? and going to them. The next would be, certainly you've touched on Medicaid. So Maureen Corcoran is the director of Medicaid. So she would, in my mind, be a target. You mentioned the infant mortality task force. That would also be a target. And then you've got some bits and pieces to the messaging. Where we would go next is, okay, very succinctly talking about what is the issue, what's the problem, what's the issue, problem, and solution, and then the results. And those messages are going to be basically the same for the state, but you could also have targeted messaging specific to the numbers in the various districts. And then from there, we start to outreach to, we're sticking just state legislators, figuring out who's the rep, who's the senator in those districts, expanding it to the Medicaid oversight committees, whose leadership on there, then engaging the community, broadening your community, who can we get to sign on the letters of support, how many logos can we get, getting that out there. You can start to do a media blitz. And I mean, we could spend a whole afternoon just on this issue alone, but it's a great issue, certainly worthwhile. And I know that we have just like a few minutes left, and I want to leave some time for Liz to kind of wrap this up with some key takeaways. So Liz, I'm going to turn it over to you, and then we can leave any other questions or time for questions.
Yeah, Yvonne's going to kick us out of the breakout rooms in just under 5 minutes.
Yep. So Liz, you're up.
Okay, sorry. Yeah. So those are all good things. The other thing is just remember, you got to get Republicans. You have to get Republicans on board. And then lastly, come up with things that they can do that are very specific. We've actually done a lot of maternal health over the years. Very specific thing. This is what you can do. This is the policy that needs to be changed. This is the amount of money that needs to go. This is what it needs to go for. And it can't be Mount Everest. It's got to be very tangible things that they can do. Just to get back to that point. So we're here as a resource if you want to call or email us or whatever after the fact. We want to help you guys. And so just keep that in mind and know that you can do this. A lot of this is just like power of your voice. That's what advocacy is. So thank you all for dialing in and for talking with us today.
Thank you.
Okay. Thank you. There is a bill to watch there that Becky was putting in the chat that's related to the doulas. That's House Bill 142, introduced by Reps Crawley and Brinkman. So we'll add that to the list of things ours is watching on your behalf.
I would just mention
a lot of money in the budget for this too. Yeah, go ahead.
Yeah, and Representative Erica Crawley from Columbus, she was successful in getting some of this in the state budget. She was the ranking member of the House Finance Committee. She left the legislature after the budget was passed this summer, and she's now a Franklin County Commissioner.
That's right.
But she got a Republican on board, to Liz's point, Tom Brinkman from Cincinnati area. And she says she's still working on the legislature, which is currently in the House Families, Aging and Human Services Committee. So, looking at the bill and examining if it's doing what you're suggesting, but adding your voice, to the process, to reaching out to these offices and mentioning that absolutely this is what you're seeing, the value in these doula services and the need for coverage, could be a great kind of low, what to my mind is a little bit of an easy lift because it's already introduced and you're just adding your voice to the need for it, and could help, raise it to a level of possibly getting additional hearings, that type of thing.
And the other one is Stephanie Kunze, who co-chairs the commission. She would be a great champion for maternal health issues as well.
Can you repeat the name?
Stephanie Kunze, Kunze. She is Columbus area senator.
Okay, thank you.
Okay.
Yeah.
One of the big things too, also I say with doula services is what we are also missing with that piece is emergency childcare in the space, because mom can go to the hospital and not have a soul. If she has doula, she has the doula, but where do the babies go? The only solution we have had is people calling children's services, and that is broken because people fear their children being taken from them and they don't trust that space. And it's very invasive when it's not asked for. And that's how they serve them up. And I don't like that. That is one of the biggest things I don't like, that part of it, because it tends to be more confrontational and accusatory, like it's mom's fault for not having somebody or a source or something like that. And never know anybody's story. You don't know why she's by herself. That might be the only way she could have saved her life, is to be alone. And so we send children's services in to take her babies while she's trying to have a baby. Can't get more stressful than that. And it is definitely against infant mortality. You stressed everybody out right in there, kids inclusive.
Thank you for that, Sister Sorrell. We are going to get pulled back into the main session. I think Yvonne has a couple things to say just to wrap things up and give you a little preview of tomorrow. We